Welcome to your first pelvic floor glow up mobility routine. I hope you've been practicing your connection breath because we're going to utilize that breath today as we take you through a mobility flow. The goal here is we're going to actually manipulate gravity, we're going to manipulate your hips, the position at which your body in to see if you can connect better to your pelvic floor. So just a reminder, the connection breath is what we want you guys to use in order to get full range of motion to your pelvic floor. So whether your pelvic floor is too tight and stuck and causing you pain or maybe some symptoms or whatever it is and you can't really get it moving, or maybe you're somebody who maybe we have some weakness in the pelvic floor. The pelvic floor doesn't want to pull itself up, doesn't know how to close properly. Generally, we might be dealing with some leakage or prolapse symptoms or maybe some decreased sensation during intercourse. Or maybe you're somebody who you just have never thought about this part of your body before. Maybe we're not symptomatic. Either way, we know people who can connect to their pelvic floors have significantly less symptoms now and even later down the road. So whatever the issue is, you're in the right spot. So the connection breath is we're utilizing the diaphragm to help the pelvic floor and our deep core turn on and turn off respectively. So as we inhale, we're thinking about dropping that pelvic floor or lengthening it. And as we exhale, we're thinking about picking that pelvic floor up, turning it on and contracting it. I'm going to go through some different cues today. Hopefully something resonates with you. So whether that's picking up or dropping down a marble, lifting up your elevator to the attic or dropping it down into the basement, I'll throw some different cues and let's see what sticks. So we're actually going to start on the ground. So I want you to find an open spot. You're going to need just a few feet of space. I want you to maybe get a yoga mat, just get comfortable. And we're going to start here. So I would like for you to start here in this folded position, or you can sit crisscross applesauce. Really just any position that's comfortable for your hips. So we're going to spend 1 minute in each position and then go from there. So I like to start with my hands on my tummy or on my sides to really help me get connected. So we're going to inhale through our nose and exhale through our mouth. So we're going to inhale first. I want you to think about breathing into your diaphragm like it was opening up like an umbrella. Blow out and let everything just passively go back to normal. We're going to start just with some inhales here. So inhale into that rib cage. Open it up like an umbrella. Blow out. Let it fall back down. I want you to just make space for, and I want you to scan your body to see what isn't wanting to let go. Is my back really tight? Is my belly wanting to stay clenched up? Is my marble stuck? But on those inhales, we want to just get the entire canister moving. So just check in and see what's not moving well. Well, I'm going to focus on that. Exhale, just let everything go back to normal. So once we've done a few inhale breaths, I want to add the exhale component. So now we're going to go and we're going to contract and we're going to lift our marble. So I'm going to have you inhale into your tummy, into your rib cage. You're going to blow out, close around that marble, pull that marble up inside of you as far as you can on that exhale. So it's going to be an inhale, drop that between your legs down, blow out, close around your marble, pull that marble up, 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 up. Inhale for me, relax. Exhale, close, and lift. Now what I want you to do is I want you to get in a hands and knees position. So here, if this is comfortable for you, you can get something underneath your knees to make it a little more comfortable on your knees. If this isn't good, on your wrists, if you have any wrist pain, you can kind of get up on a bench or on a ball, or you can even lean over a countertop if that's more comfortable for you. But here, we're going to do the connection breath here. So now I want you to think about the cues more of on your inhales. I want you to let your belly drop to the ground. And then I want you to think about your booty hole. I want you to think about breathing down into your bottom. I want you to think about your bones pulling apart. And then as you exhale, you're going to pull those bones together in your bottom, and then your tummy is going to come up second. I want you to keep going here, and I'm just going to kind of ask you a few questions. Do you feel like you're able to do it in the order in which I'm asking you to do it? Exhale, close your holes, pull your pelvic floor up, and then pull your belly in. A lot of times we see that order can get out. So people will pull their bellies in first, then they'll exhale, and then they'll lift their pelvic floor. We want you to do it in the order in which we're saying. And then same on the inhale. I inhale. Am I able to let everything go simultaneously and drop it all down? Is it really choppy? Does my marble want to kind of stay up and I feel like I have to push it down? Do I have no idea where my marble is? Those are all pretty valid reports of how this feels for people. And just know that that's okay. We want you to just keep practicing. We see the best thing to do here is just get the reps in. So now I just want you to answer, did you feel that better on your hands and knees versus sitting? We see that some people feel it better in one versus the other. And if that's the case, that's where we want you to start. We want you to take advantage of where it's easier for you, but then also knowing we want to get better at the thing at which it's a little harder. We're going to do one more position, something to kind of throw you for a curve, but let's just see kind of how it works. Is we're actually going to get in a half kneeling position. So I want you to get here, 1 foot up, 1 foot down. Here, we're actually putting the pelvic floor in a little bit of an asymmetrical position. This is a great time to actually palpate or to feel. So you're going to take your hand, and I want you to put it right there in between your legs. So you can put it on your perineum. You should feel this part of your body move up and down if you're doing this correctly. So you're going to take an inhale, and as you inhale, you should feel your tissue drop into your hands. Blow out. Can I feel that area in between my vaginal opening and my anus pull up from my fingers? Inhale, drop it back down. Exhale, close, lift, and pull it up. I'm going to give you an opportunity to do 2 more breaths there. Okay, so now I want you to flip your legs. I want you to put whichever one you started with, I want you to go the opposite direction. I want you to still use your hands to palpate if possible. And I want you to do about 5 or 6 breaths here. And I want you to tell me or tell yourself, do you feel different right to left here? So I want you to try that. You're going to inhale, breathe into your belly, breathe into your ribs, breathe down into that pelvic floor. You're going to blow out. Close, lift, and then zip that up, draw that tummy in. Inhale for me, let go. Blow out. Close, lift, pull that tummy in. Couple more breaths here. So that position could have potentially been harder on one side versus the other for you. So we have those hips in a stretched position. We have one hip that's on slack and one hip that's on stretch. And same with our pelvic floor. So this is where we're going to see some people do better when the left is flexed or or maybe the right is flexed. And so again, this is something that hopefully more than anything, we just want you spending time connecting to and seeing what works best for you. This is also going to be evidence or data for you of if you are somebody who struggles with some issues of like, hey, it's easier on the right. I also maybe have some right hip pain, or I have a tight right glute, or whatever that is, where it's like, okay, those are things that we can kind of tease out to, again, make sure that those hips are nice and mobile so that that pelvic floor can come all the way up, come all the way down, no matter what position it is, so that it can give to you and do what it needs to do, the best job for you when you need it done. So I want you to go through that today. And ideally you do that at least 2 or 3 times a week is what I want you to do until you hear from us again. I want you to try a seated, a hands and knees, and then a half kneeling position. Give yourself about 10 to 12 breaths in each position, and then let's see how that pelvic floor does.